Landmark Trials for the Management of Acute Appendicitis. Welcome to this episode, where we explore the remarkable transformation in the management of acute appendicitis, a journey shaped by pivotal clinical trials over the past 2 decades. Today, we will discuss how traditional approaches have been challenged, the evolution of surgical techniques, and how these landmark studies are now guiding patient-centered care and antibiotic stewardship. Let us begin with one of the most significant shifts in the field: the debate between antibiotics and surgery for uncomplicated appendicitis. For over a century, surgical removal of the appendix was considered the only curative treatment. However, recent evidence has prompted clinicians to reconsider this default. The Appendicitis Acute trial, published in the Journal of the American Medical Association in 2015, asked if antibiotic therapy could be as effective as surgery for patients with uncomplicated acute appendicitis. This multi-center, randomized trial in Finland enrolled patients whose diagnosis was confirmed by computed tomography. Participants were randomly assigned to either emergency appendectomy or a course of antibiotics, starting with intravenous ertapenem for 3 days, followed by 1 week of oral levofloxacin and metronidazole. The results were striking. After 1 year, nearly 73% of those who received antibiotics did not require surgery. Although the trial did not formally prove non-inferiority, it demonstrated that the majority of patients could be treated successfully without an operation. This finding opened the door to shared decision-making between patients and clinicians. The conversation did not end there. The 5-year follow-up, known as the Appendicitis Acute 2 trial and published in 2023, sought to understand the durability of antibiotic therapy. It showed that about 39% of patients who initially received antibiotics experienced a recurrence within 5 years. However, more than 60% avoided surgery altogether in the long term. Importantly, rates of complicated appendicitis and mortality did not differ significantly between those who had surgery and those who did not. This reinforced the idea that antibiotics can provide a lasting solution for many, with recurrences being manageable if they occur. Further broadening our understanding, the Collaborative for the Diagnosis of Appendicitis trial, published in the New England Journal of Medicine in 2020, compared antibiotics and surgery in a far larger and more diverse population across 25 centers in the United States. This trial also included participants with small stones, known as appendicoliths, in their appendix. The study found that antibiotics were just as effective as surgery based on patient-reported health status after 30 days. However, those with appendicoliths were more likely to experience complications and eventually require surgery. The take-home message was clear: antibiotics are a safe first-line treatment for most adults with uncomplicated appendicitis, but the presence of an appendicolith increases the risk of treatment failure. Next, let us turn to the surgical approach itself. The move from open surgery to minimally invasive techniques marked a major advancement in patient care. In the early 2000s, multiple randomized clinical trials, such as those published in the Annals of Surgery, compared laparoscopic appendectomy to the traditional open method. These studies consistently demonstrated that laparoscopic surgery resulted in less post-operative pain, shorter hospital stays, a quicker return to normal activity, and lower rates of wound infections. The trade-off was a slightly higher risk of abscesses inside the abdomen. Nevertheless, these findings established laparoscopic appendectomy as the preferred option for most patients and surgeons in developed countries due to its superior recovery profile. When it comes to complicated appendicitis, such as cases involving a phlegmon or an abscess, the initial management often involves antibiotics and possibly drainage, rather than immediate surgery. The question arises: is it necessary to perform a planned, or interval, appendectomy after successful non-operative treatment? The interval appendectomy versus follow-up after percutaneous drainage trial, published in JAMA Surgery in 2021, addressed this in children. After successful initial treatment, participants were randomized to either undergo interval appendectomy or simply be observed. The results showed that the recurrence rate of appendicitis in the observation group was low, and routine interval appendectomy did not reduce rates of recurrence or healthcare visits. This supports a wait-and-see approach rather than automatic surgery after initial recovery. Another important aspect is the use of antibiotics around the time of surgery, especially for complicated cases. The Appendicitis Acute trial, published in The Lancet in 2018, compared 2 days versus 5 days of postoperative antibiotics in patients undergoing surgery for complicated appendicitis. The trial found that a 2-day course was just as effective as a 5-day course in preventing complications such as intra-abdominal abscesses and surgical site infections. This supports the practice of shorter antibiotic courses after surgery, which not only reduces unnecessary drug exposure but also promotes better antibiotic stewardship. To summarize, the management of acute appendicitis has evolved from a one-size-fits-all emergency surgery model to a nuanced, evidence-based approach. For uncomplicated cases, both antibiotics and surgery are safe, and the choice can be tailored to patient preferences. Laparoscopic appendectomy has become the standard surgical method due to its benefits in recovery. For those with complicated appendicitis and an abscess, initial non-operative management is often sufficient, with routine interval appendectomy being unnecessary in many cases. Finally, shorter courses of antibiotics are now recognized as adequate after surgery in complicated cases. Together, these landmark trials have transformed acute appendicitis management, prioritizing patient-centered care and responsible use of antibiotics. That's it. Thanks for tuning into today's episode. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.